Welcome back to The Point. I'm Marcel Wieder. The threat from Ebola has made headlines for the past several months. In West Africa, nearly 5,000 people have died after contracting the virus. More than 400 health workers in Sierra Leone have gone on strike amidst the crisis. The World Health Organization has declared the outbreak a global health emergency, and the threat has continued to draw nonstop coverage as cases turn up in the United States. A returning American visitor contracted the deadly disease in Dallas and later succumbed to the illness, setting off alarm bells. Meanwhile, in Ontario, people remember a situation not long ago when SARS claimed 44 lives in 2003. To talk more about how prepared Ontario is to deal with the threat of Ebola, I'm joined by Andy Summers. He's the Vice President of Region 3 of the Ontario Nurses Association Board of Directors. Andy, thank you for joining us today. We've seen images from Western Africa of the victims of Ebola. How significant is the threat to Ontario?
I think it's important that all Ontarians are aware that their personal threat to the general public is very, very low. The main issue here, I would suggest to you, is if you work within hospitals, work within healthcare itself. This is the area that we need to make sure that we have all the precautions, all the equipment, all the training necessary to deal with these illnesses or infectious diseases that are not easily caught.
Now, Ontario became ground zero for the SARS epidemic. What lessons have we learned from that, and how are we applying that today?
Well, I remember SARS. I remember SARS 10 years ago. I was an emergency room nurse, and I remember how surprised we were. Here we were, a very robust, well-funded healthcare system, and we didn't think that we could be consumed by SARS, but SARS very quickly did consume all of our consciousness. And here we are now, 10 years ahead, asking ourselves the same question. Have we learned anything from SARS, and do we have to relearn it again? What I would like to say is, yes, we've learned a lot, but in some sense, we need to learn a bit more. We have learned, and thankfully in our discussions with the government, they are very attentive to listening to frontline nurses. Now, here we are, we have nurses who are being listened to by the government, are involving nurses in their decision-making. But yet we still have facilities and large healthcare organizations that struggle with the concept themselves of listening to nurses. We also, I would suggest, have communication glitches between ministries of the government, for example, between the Ministry of Health itself and the Public Health of Ontario, offering different instructions and different guidances to healthcare professionals themselves. And it just sort of reminds me a little bit about 10 years ago, where we had communication glitches between ministries and between key organizations in healthcare. And of course, particularly I think in the States, they had a very similar issue where the CDC was offering directives, but their National Institute for Occupational Safety in Healthcare, NIOSH, was not agreeing with them. And this is a common issue that we're still seeing 10 years ahead, is that the culture and the philosophies of infection control are not meshing with the philosophies and cultures of health and safety.
Andy, in Ontario, we have the Ministry of Labour that's responsible for looking out for health and occupational safety for workers. And then we have the Ministry of Health. Are those two ministries working together on this issue?
I'm very comfortable in saying that at the tables that I've been sitting at, where both ministers have been there and where we've been having these discussions, that yes, it does seem like they are. They both agree that nurses' safety is paramount. Because we're very, very aware that if you don't protect nurses or other healthcare workers, you actually can't protect patients. And that was one of the key things that we learned during SARS, is that if we are not protected, then we can actually become part of the problem. So yes, I will say that both ministers appear to be very much on board, but we now need to see that realized right where those nurses are working, either in their emergency departments or in their ICUs, etc.
And we've seen in the States where a nurse was quarantined on just a suspicion of contracting Ebola. And we've had other examples in the US where nurses have been isolated after treating patients.
Well, this is a bit of a sensitive issue, I'd be honest with you. There needs to be some really good reason for quarantining anybody. And I'll be honest with you, I think individuals may need to be quarantined, but not because they simply were treating patients with Ebola. And this was one of the issues that I noticed coming out of West Africa, which is a place that right now needs a lot of resources. And a lot of people are going over there to help. We're going to be quarantining individuals just for helping out in West Africa. Now, if there's been some failure in the protective system that's there for nurses, whether it's equipment or some process or protocol, then there may need to be precautions. But I do think that some of these quarantining policies and procedures have been created to keep others calm.
Well, you raise an interesting point because the Harper government is basically putting everyone who comes from any of these countries in quarantine, even though they may not have or exhibited any signs of contracting that disease.
Not something that I think is very, very useful. If we want to prevent the rest of the world getting Ebola, we should remove Ebola from West Africa. That's what we need to do. This is one of the issues that we learned during SARS, is that you can't necessarily prevent SARS arriving or Ebola arriving. You have to deal with it at its source. So we need to provide all the necessary resources there. I'm not sure that preventing people coming from West Africa is really that wise or useful.
So getting to the source of Ebola and eradicating the disease at the source is the best prevention for Ontarians.
Absolutely.
Andy, thank you again for joining us on The Point and sharing some of your views.
Thank you, Marcel. It's been a pleasure.
Up next on The Point, is the LCBO ready for an overhaul?